in New York State, there's an anticipated shortage of healthcare workers due to tens of thousands of them failing to comply with strict state vaccine mandates. I'm wondering if the Biden administration is learning anything from these New York mandates as it's drawing up its own federal version of them, and if there's any surprise by the number of people who haven't complied and haven't been vaccinated.
So, as it relates to New York, one, we are tracking that a number of states, New York is one of them, are beginning to implement, as they're beginning to implement requirements, they're taking steps to work with healthcare systems to ensure that they have alternatives that they can backfill as needed. And that certainly is something we support, that some states like New York are doing. I would note that when this decision writ large was made, and this is the reason we did it on a federal level, right? It was because healthcare workers who've been on the front lines of this pandemic for a year and a half now were feeling at risk for their health, for their lives, for their children's lives, and also it was creating a great deal, not a bit of a lesser concern, but one for hospital associations for disruptions of workers, right? People were having to take off sick time, and even worse, of course. So this was a step that was taken in order to address that, to create certainty for these healthcare workers and also these systems. We have seen in a number of places around the country, the Methodist Hospital in Houston, which was one of the first organizations to implement a vaccine requirement, that they lost only 153 out of 25,000 employees. That means of the implementation of the vaccine mandate, I should say. That means less than 1% quit over a vaccine requirement. And new employment data out of Maine showed that only 65 people out of 33,000 healthcare workers quit their jobs over a vaccine requirement. Henry Ford Health System in Detroit went from 68% vaccinated to 98%. So point is, we're seeing in a lot of places that this is working, it's effective, it's creating more certainty and protection in their workforces. There are places where they are contingency planning to ensure they're backfilling. We certainly support that as well. We stay in touch with them about the steps that they're taking, but we still continue to believe that putting in place these mandates for businesses over 100 workers is something that is a positive step for the workforce, for the country, and for a lot of these businesses, as these business leaders can attest to as well.
Is there anything sort of special about the New York rules? I mean, for example, there's not a religious exemption even there that the Biden administration might be looking at and thinking this might be a little bit too strict for what we would want to do nationally. Because it is a much bigger, I mean, to your point, most of those places that you mentioned are having tiny sort of like, amounts of people leaving, but New York seems to be an exception.
Sure. I know that obviously OSHA and as they're working to do the rulemaking that Weija asked about earlier, they're looking at a range of ways to make this as efficient, as clear for businesses as humanly possible. We've talked a little bit about the expectation of an exemption for a religious exemption, which is something certainly they'll look at. And I'm sure they will look at how it's applied to different health systems across the country, as well as businesses and how they have applied it across the country in the private sector where it's already been implemented as well. So they'll look at all of that. Their objective is to make this clear, but I think it's also important to note that in the vast majority of places, it's actually been quite effective. There's been a very, very small percentage of people who have left the workforce as it's been mandated.